Onset of the disease. While the first symptom of the prostatism for which the patient consults a physician may be hemorrhage, a prostatic abscess, some sexual disturbance, or some other relatively unusual manifestation, the symptoms usually begin in one of three ways. The usual type. The symptoms begin with nocturnal frequency and difficulty of urination. This increases gradually, and the patient passes on through the first, second, and third stages of the disease as described below. The acute complete retention type. Acute complete retention of urine may supervene at any moment in the course of the disease. It is the first symptom of importance in almost half the cases. If promptly treated, it may sometimes be relieved, and the bladder resume its ability to empty itself satisfactorily. But if the infection cannot be controlled, or if after relief of the acute complete retention some residual urine remains, the acute complete retention will soon recur. Very few patients with acute complete retention escape further trouble within the year. Yet they may escape for a number of years without any further symptoms. Urinary toxemia. The patient with a tolerant, uninfected bladder may never have an acute complete retention of urine and may not concern himself about his gradually increasing frequency of urination. He may thus reach a condition of chronic distension of bladder and kidneys without consulting a physician. Under such circumstances, the first condition that he notes is a loss of weight and strength, accompanied by constipation and dry mouth. Even these he may not note until a slight infection adds fever to his symptoms. Such patients, unless carefully examined, may be treated for digestive disturbances for a considerable time. Though the mere laying of a hand upon the lower belly identifies the distended bladder, and intelligent investigation of the patient's history will reveal polyuria, frequency of urination, and dry mouth.